Hi everyone, I hope you're all keeping well and safe. It's Mr Neel Raithatha here, also known as the Wax Whisperer. Thank you for tuning into my latest video. So, for a patient who attended with a right-sided fungal ear infection, their GP had prescribed some Canesten antifungal ear drops, but advised to have their ears microsuction prior to use, so it's more effective because of all the debris. So you can see the ear canal is very inflamed. There's a lot of edema, swelling of the ear canal, and a lot of this white debris, so what we call otter ear. And it's fully occluding the entire ear canal and also impacted onto the eardrum. So this debris, it's infected debris, but also a lot of dead skin, a lot of dead keratin. And you'll see as the procedure continues, we'll be peeling a lot of this dead skin off the patient's eardrum directly. So just using a fine end gauge to delicately suction this wax, debris, dead skin off the base of the ear canal and off the eardrum. I'm actually doing this voiceover via iMovie on my iPhone. However, when I'm narrating, some of the view is obscured by the volume meter. So hopefully, as I'm narrating, it is accurate to what's actually going on. So the suction probe just got blocked there, just giving it a little wriggle, trying to unblock it, and you can see just how swollen this ear canal is. It's quite red. A normal healthy ear canal should be pink, but a bit more pinker as opposed to a bit more red. So you can see this dead keratin on the posterior canal wall and eardrum. Just gently peel that off. With fungal ear infections, they can be very difficult to get rid of, actually, even with the correct medication. So in this case, Canesten ear drops. The best method really is to obviously use any medication prescribed by doctors, but also have your ears cleaned. It gives the best opportunity for the fungal infection to be cleared. So again, just using a fine end gauge, just gently peeling off the canal wall. When you've got an ear canal that's quite swollen and inflamed like this, it's a lot of soft tissue. That's a lot of fluid in the soft tissue. It's almost like a bubbling effect inside the ear canal. It's very bouncy, the ear canal walls. And sometimes when you peel a bit of skin, you can get a bit of blistering. You will see that, I think, a bit later on in the procedure. There's a bit of a blistering on the anterior canal wall, so there's a bit of bleeding, but very mild. That'll heal very quickly. So this is the patient's handle of malleus, so the short process. So the pointed bit at the top of the hammer bone, and it's just a bit of keratin over it. So just be careful. I don't want to make direct contact with the hammer bone. So the hammer bone is underneath the eardrum, but it is protruding outwards. It's prominent. So it would suggest that this patient's eardrum is also retracted, it's sucked in. So you can think about the eardrum like cling film, and it can wrap around objects if it's sucked in. So the eardrum, the membrane, it's 3 membranes thick. You've got the outer lateral layer, which is an epithelial skin layer. It's the same skin that lines the inner 2/3 of the ear canal. Then you've got the middle layer of the eardrum, which is a connective tissue fibrous layer, which gives it rigidity. And then you've got the innermost layer, which is a mucosal layer. And so in total, the eardrum is probably about 0.1 millimeters in thickness. And if there's negative pressure behind the eardrum in the middle ear, so if you've got a blocked eustachian tube, for example, if you imagine when you go on an aircraft as you descend, the air pressure in the plane is greater than the air pressure behind your eardrum in the middle ear. So your eardrum gets pushed inwards, it gets sucked in. We call that a retraction, and the eardrum can wrap around the middle ear bones, the hammer bone, the andle, which is also known as the incus, and also the stapes, which is also known as the stirrup. And that's due to typically a blocked eustachian tube. So there's a little orifice called the eustachian tube. It's a tube that connects the middle ear cavity to the back of the nose. And it's a ventilation tube, so it helps equalise the air pressure. Ideally, we want the air pressure behind the eardrum to be equal to the atmosphere. And the eustachian tube is generally closed, but during brief moments of swallowing or yawning or chewing, this eustachian tube the muscles, which is near the base of the nose, the nasopharynx, the back part of the nose, these muscles contract and it opens up the eustachian tube, so air can either enter to equalise the air pressure or it can escape to equalise the air pressure. And the eustachian tube is also acts as a drain pipe, so any fluid that accumulates in the middle ear, it can drain away from the eustachian tube. But obviously if it's blocked, there's no air behind the eardrums, the eardrum gets sucked in like a vacuum and you get a fluid buildup. I hope you enjoyed that video, guys, and you're all keeping well and safe, and I shall speak to you all soon. Bye.